All right, so we're going to get started. So I'm so excited to be here today with Mary Bork. Is that how we pronounce it?
Well, we say Burke in Australia.
Burke. Okay, then I'm going to revise and we'll start again. And Julie will cut it. So I'm so excited to be here with Mary Bork, who's traveled here from Australia as an owner and not necessarily founder, but grown up with the MyoMunchee.
Yep.
As her father was the creator of it, Dr. Kevin Burke.
That is him.
And it's since 1967.
1967, the very first MyoMunchee.
Super exciting. And I'm very, very grateful for you to take time before the seminar, before the class that we've come in to Chicago for. I know how crazy things can get before a seminar starts. So I'm so grateful for the time and I'm super excited.
Pleasure to be here with you.
Okay, good. So as we talked about before we started recording, really 4 main things we want to accomplish today, guys. The first one is that we want to get a real good understanding of what the MyoMunchee tool is and how it can be used, how it's originated, how it's migrated over the years. Secondly, how it can be used with our speech therapy myofunctional clients to best help them and get the most benefit out of it in conjunction with the therapies that we're doing. Third, I want to talk about how we've been prescribing and recommending speech therapists to use the MyoMunchee as part of our Tiny Tongue Tips kind of homework protocol, which we've recently launched in the past 6 months. And lastly, I want to make sure that everybody gets a real good understanding from you, Mary, as to how to determine what size, how to fit patients for it. Secondly, how they can order it from you as practitioners. So, thank you.
All right, excellent. Do you want to start with the first question again for me?
Yes, I have
Let's break that down and we'll go make sure we cover it all.
Okay, so first we want to gain an understanding of the MyoMunchee itself, its origination and so forth.
So for those of you who haven't actually seen one, this is a MyoMunchee, and it's got little prongs on it, and it's those little prongs in there massage the gums and the teeth. And when my father invented it over 50 years ago, he invented the MyoMunchee as a tool for help with periodontal conditioning of the oral cavity. So that's sort of how it originally started. What he found over many years in practice as a dentist was that it was really, really helpful also for improving the lip tone and function. And then over many years more, it became really apparent that it was actually a brilliant myofunctional tool. So it's actually a really great way for the program you're talking about. It's just it's a perfect adjunct. And when you talked about it being the homework, it's a great integration tool. So when you give specific exercises, as you'll be giving them, and the speech pathologist, you know about a lot of specifics around that oral area. What happens then is you put the munchie in and they chew it, and it gives the brain a big burst of all sorts of really good movement and function to allow it to integrate all that work that they've been doing. So it's actually a perfect little homework tool.
That's awesome.
Yeah, so that's the general idea of the MyoMunchee.
Yeah, and I've been using it in my practice for a while now, actually for a couple of years. And I also think about it as a way to kind of get some pre-orthodontic kind of normal growth development going along the way. So
and a lot of speech pathologists get quite nervous around thinking it's a dental appliance, but it's really not a dental appliance when you use it as a chewing appliance. When you chew 10, 20 minutes a day, what it is it's chewing, but you're having the jaws in a good occlusion, balanced occlusion. And what that allows is, if there's imbalances and things, it allows the body to start to sort it out. So you're not doing anything that nature wouldn't be doing for the body. So you're actually just helping putting something in that's allowing the system to find balance again. So don't feel nervous of it as a speech pathologist using it, because it's very much Dad was speaking to speech pathologists about this back in the 90s, because he could see that they had a really good understanding around why that was so important. So
I think that's an interesting point, because I think us as speech therapists, sometimes we get a little nervous. This looks like something like a myo brace or like mouth guards or like some orthodontic treatments that are out there, and we know that that's not necessarily within our scope of practice. What I love about the MyoMunchee is that we can prescribe this, we can give it to be used on a short-term kind of basis, and know that we're not doing any harm. We're promoting good things. And what I talk about in my classes all the time, and I know you guys will, I'm redundant, I say the same things over and over, which is that over time, things have changed for our kids these days. They're eating more processed foods. They're not eating the food that has helped to build the strong musculature for chewing and swallowing and breathing and et cetera, and growth. And so this is just a tool that we can prescribe and use to promote that positive.
And it's so important because you guys see these children under the age of 5.
Yes.
And this is where we can have the most profound impact in that primary dentition. And dentists often don't see children under that age.
Right.
So we can have a really, and I'm a chiropractor, I work in a chiropractic clinic, and I work a lot with pediatrics. And that's my big passion, is the under 5s, and how can we help influence that system to try and find better balance and function.
You guys were the superstar team between your dad as a dentist and you as a chiropractor.
It's good. It gives a good broad understanding. We haven't got a speech pathologist in the family, but gee, I like hanging out with you guys.
Yeah.
You do amazing work, and I think you have such an important role to play in this field because you do see the little ones.
Yeah, great. All right, so that takes us to our second question, which we talked a little bit about, which is really how the MyoMunchee, I'm pulling up my questions. Here we go. I know there's a whole list of benefits, and we touched on them lightly for a speech pathologist doing OMT using a MyoMunchee. I know we can list them out there in your pamphlets.
Yeah, they are. But the big ones from my perspective are that they build the chew, which the chew muscles, which will help support the jaw, which then helps support the tongue. So it's a great way of developing a lot of that muscular support for the jaw. Lip tone competence around that orbicularis oris area. Swallow. When you've got a munchie in your mouth, it's a mouthful.
Yes.
And you can't thrust your tongue forward when you've got that in your mouth. So you have to use your posterior aspect of your tongue and your pharyngeal walls. So it's actually an amazing tool from that perspective as a reinforcement to improve that tongue function and the tone of the muscles back there, which probably haven't been activated a lot of the time.
Right.
And the other thing that it's
Can
really...
I ask something about with the tongue with regards to that? Just because I've looked at a bunch of myo braces that one of my orthodontists uses.
Oh, yeah.
Does this guide your tongue as to where to go? Meaning, I see inside that there's that kind of scooped out area in the middle. Do you tell them to put the tongue up towards the roof?
No,
or you don't.
We are going to try and design some things. You've stopped that at the moment, or you?
No, we're still on.
Oh, we're still on.
I was getting
Okay.
more questions. Yeah.
Yeah. Well, at the moment, the way the appliance is designed, because it was designed as a chewing, more teeth cleaning type appliance, it doesn't have that specific guidance for the tongue. But what you can do is you can trim a little piece away in that section at the top of the munchie there, which will then attract the tongue.
Okay.
So if you're trying to
you use to do that?
Little scissors, just little scissors.
Just a tiny pair of scissors, or even at your orthodontic practices or dental practices that you work together with. We do a lot of collaboration.
Yeah.
They have tools all the time that probably could do a little scissors.
So we have little scissors in our protocols for that we give to people because that's something that we, these are very much trimmable. You can trim. So what we do is, suggest you cut a little piece away that just enables the spot, the tongue to get to the spot.
We call it the bump.
The bump.
The bump, the spot,
Yeah, that's that place. So no, what the munchie does when you have it in, because you can't tongue thrust, it really helps with that posterior tongue. So in conjunction with your other tongue work, you do need other tongue work. The munchie won't correct that tone and function of the front part of the tongue, but it will help activate your pharyngeal wall, which is really helpful. Perfect. The other great thing about the munchie is that it, when you've got it in your mouth, once again, you can't mouth breathe. So it really promotes that nose breathing that we're all working towards, get that tongue off the floor of the mouth, up onto the roof of the mouth. And there was one other thing I was going to say about that.
TMJ, maybe?
Oh, TMJ, it's helpful for that, but it's if you're working in the myofunctional space with TMJ patients, we've got some protocols around that. Once again, it's a controlled, balanced, very gentle exercise. And you can use this appliance passively if you're in the adult population as a support to allow oral rest posture and things to start to shift from a TMJ issue and things.
What if you have a patient who has a fairly good bite, or they've been through myofunctional therapy, they've been through orthodontic work, but maybe they haven't mastered this lip closure, nose breathing? Could it be used just as a tool to accomplish nasal breathing?
It's a really helpful reinforcement. It's a really helpful.
Do anything to the bite?
No, it shouldn't do. All it'll do is allow I wouldn't suggest they sleep in it because it will start to affect orthopedic changes if you sleep in it.
Oh, so nobody sleeps in this device?
Unless under dental care.
Important, guys. Nobody sleeps in this. That's actually really interesting because myo brace is the opposite. They want you to.
But the speech pathologist isn't prescribing a myo brace.
Got it.
A dentist is prescribing a myo brace. MyoMunchee can be used by a dentist to sleep in. But speech pathologists don't prescribe that because you will get dentists giving you flack about being out of scope. Because you will change teeth position with that.
Okay,
Yeah.
that's actually a great point. Just before I came, I work with a pediatric dentist and orthodontist in one practice. I work there once a week. And we had done a whole course on my brace, which I know is another. I wanted to talk about the differences. They really wanted me to ask you about the differences and benefits, etc.
Well, you're going to find out a little bit of history there today about that. But basically, the biggest difference with this appliance is this is a true myofunctional appliance because it's active.
Okay.
You actively chew. And the other big advantage of the Munchee, which I was going to mention before and I forgot, when you chew, those little prongs produce a lot of saliva. Now, when you produce a lot of saliva, you've got to work out how to manage that saliva.
Yes.
And what you've got to do is activate your swallow muscles. So that's a big advantage of the Munchee. The other big advantage is it's a chewable 10 minutes a day. You don't have to have it in your mouth passively, and you definitely don't sleep in it overnight if you're being used by a speech pathologist. From a dental perspective, it's flexible. It's quite different to the Myo brace. The Myo brace
so rigid.
is bracing. It's trying to create orthodontic changes. The MyoMunchee is not. It's trying to optimize orthopedic bony stimulation and growth and room for the teeth. So,
and we know, guys, that if you get that room for the orthopedic growth, proper jaw development, that you're creating room that maybe you don't need at the intervention.
Yeah, unless you want perfectly straight teeth. Yeah. If you can get the right room, the lips and the tongue will do a lot of that work, won't they? Once you get those in the right balance and function, for sure.
Perfect. Will you show them the sizes?
So this is the extra small is the one on the right, and the small is the one on the left. We're going to be changing our names for our things soon, so it makes it a little easier. It'll be 1, 2, and one.
That makes sense.
Yeah, make life a little bit simpler for you. But at the moment, the way they exist is the extra small is from the ages of about 2 to 4, and then the small comes in at about 4 to 5, and it has enough room for the 6-year-old molars. So you can sort of use this one here up to about 5, depending on the size of the child. And then we're just bringing in our little baby one.
Love it.
This is our little baby Munchee, and our little baby Munchee is for the babies. So hopefully we're going to be using this with babies from about 7, 8 months. Just to start getting that stimulation of the chew reflexes and some extra tongue. Yeah, it's extra. It's brand new, not available yet. So don't try and buy one because they're not available yet. Yeah. We're just coming up with the protocols of how to use them.
Cool.
Something we're talking about now, Jennifer, which you might not have seen on we're just putting together some protocols on using the stick.
Right.
Chewing the stick like you would a chewing tube or something.
Nice.
Because, what we're finding is that lack of jaw grading, which I'm sure you're very aware of, they're much more likely to break through them if they've got those really heavy,
real deep
chew reflexes. They've got no idea of the posture and position of those jaws. So we're thinking if you start on the handle and then you come up to the front once you've done a little bit of work with them.
Because I've just had 2 people that
break through them.
Yes, exactly. And they asked me, can I purchase another one? And I did not have an answer for them.
Yeah.
So
that's sort of what we're So if you know that you've got a big class 2 overbite or a really big malocclusion, a lot of imbalance.
Okay.
You're going to start with chewing the handle in conjunction with some of your other tongue toning and function to start getting the brain much more aware of the posture.
I love it. That's fantastic. I like that idea.
Yeah,
I'm a fan.
One, isn't it? Yeah.
And for these guys, I'm thinking about all the young ones that we have that are thumb suckers.
Yes.
As a way to help wean off those oral habits. We have an oral habit elimination program that we do thumbs up. But this might be a really nice tool. Yeah,
absolutely. And that's what we're really hoping. And we've just put together hundreds of articles on the impacts of pacifiers. We're just starting to present that now. We've done the research and we're putting together some information for providers so that they can start having these really informed conversations with parents, because there's a lot of information out there that says that there are implications, and if parents realise, they would make different choices. So if we can help give them the information so they know that it can be used, but for short periods of time. And we need to try and have those conversations, which I'm sure you speech pathologists do anyway. But we're going to try and drive a little bit more of a campaign to the public about the impacts ongoing.
I always say, when you're a parent, when you know better, you do better. So when you know that maybe what you're doing is having a detrimental effect, you would not do it another time.
And you'll make it sure it's in there for less.
Yes.
Okay, you might use it to pacify, but then you will take it out.
Yes, exactly. Exactly.
We're not going to say that people are never going to use it again. No judgment there, no judgment, because we we know what that's like with small children, as you do as well.
I always say, I made my first to be what she is, and I've learned every time after that. So, and she's awesome. But okay, great. So that gave us a little understanding of that. Third, I didn't even really get to show you our Tiny Tongue Tips program. You guys all know it. If you're a member, you guys have this. You have it in your portal, and you know. But what we did is we took the 5 different aspects of myofunctional therapy. We took warming up the muscles, and we did breathing time, mouth time, which are the actual exercises, talking time, and then chewing, and we call it sip and snack time, which is eating time. And during every session, our patients participate in this. These are the little guys. And it's really more just for exploration, like exposure and exploration and what's proper and promoting what's proper and practice.
Fantastic.
And then in every session, we have groups of kids and we talk about it, and we have tons of games and activities.
Wow.
What they do. We have songs. We have pictures of kids doing exercises.
That's fantastic.
Yeah, it's really fun.
Wow.
The hard part comes when it's time for homework.
Yeah.
And it's really hard parents have a lot going on.
They do.
And if you have multiple children, we know from experience it's really hard to find time to sit down and then do your mouth exercises.
Yeah.
So we thought it would be a great partnership to work with MyoMunchee just for a good 5 or 10 minutes a day to practice chewing with your proper postures.
Yes, and that's brilliant. And I think that'll tie in really well, because what we're going to try and put together are the resources to make that absolutely compliant for parents.
Okay.
So at MyoMunchee, it's our mission to make it so that it's the new thing. Chewing's cool.
Yeah.
Everyone has one, and we want to do it. So we're really keen to promote that too, because if you chew as a family, if your siblings are doing it, even if you're the only one in therapy, your siblings also have one, your parents might have one, because everyone needs to chew. And that's, this is a really useful tool for helping when there's a condition, but it's actually also just a really helpful little tool for keeping facial tone and function and keeping your oral health cavity clean, because as a human species, we're just not, as you said, chewing enough. So it's actually the perfect partnership, and we're really keen to work with you in that space to help those parents get them chewing, and just to understand the importance so that they can come and hear from us, okay, this is why that's so important, reinforcing what you're doing.
That's great. I'm glad. It's a really good connection.
On
the way here, I was reading Dr. Stephen Lynn's book, The Dental Diet. I'm sure you've read it.
And he lives not far from me.
I bet. I knew. So I've been reading it, and I reread it, and there was a quote in there where he was talking about that there's really just like a new wave of dentists and orthodontists that really believe in this idea that you shouldn't wait for your jaw growth to be final before you have intervention, that there's really early intervention with, for him, his effective diet, from my perspective, speech pathology and myofunctional, yours, the use of the MyoMunchee, that you really can have optimal development.
You can. There's a lot you can do. And what we've got to try and do is go, this is the picture now, but what can we do to shift that next generation with the information we have? Because we're now really understanding. So that's my mission, is start to shift that genetic potential of that next generation that's coming through now.
Yeah, it takes a whole generation it took a whole generation to get here. Yeah. So now we got to turn it around and go the other way.
Yeah. And that's Kevin Boyd, who's attending today, which is exciting.
Great.
He's a pediatric dentist here in Chicago, and he does a lot of work in ancestral health with jaws, and he says 2 generations to shift that back. So we're on the journey.
That's exciting. And then the last thing I want to make sure we talk about is how our practitioners can go about getting a MyoMunchee, because you guys are a distance away, but I know there's ways.
So at the moment, if you go onto our website and order, we post everywhere in the world, but we do have a distributor or someone who will post out for you on our behalf up here. So if you order from us, you still, it's always expensive, because the product has to get here from Australia, and then we have to post it out. So it's still the same whether you order through us, but you will get it in 2 days.
2 days?
Yes, so you can get it directly posted from the US.
Okay. Is that through MyoMade Easy?
So Rhonda, she works for MyoMade Easy, and then she posts that for us.
Okay, that's great. You guys know, because in our seminars we talk about Ombre, which is a company that we get materials for, and MyoMade Easy. And Rhonda's spoken at some of the seminars that I've done, so we have a good relationship with her.
Yeah, so she's a great resource for if you want to grab one for a child here and there until you get confident with it. When you start to understand how to use MyoMunchee, this is our MyoMunchee handbook for practitioners, which we're just launching. That's why we're over here in the US. And when you become a provider with us, then you order from us in Australia, and you will get a practitioner price when you're ordering quantities. So get confident with them, use 1 or 2 here and there, and then once you get that, then it'll you can get in touch and register with us. But we are launching a new website in a few.
Oh, it's a busy time for you guys.
It's all happening, but it's been happening for a while. But that will have US compatibility, and then once that's there, it'll be in US dollars, it'll be on US soil, and you'll get it, and you'll know exactly what you're dealing with.
Can I ask how much it is? Like if you're ordering individually versus as a practitioner?
Yeah, at the moment they're 99 Australian dollars, which
Okay.
conversion-wise is about 69. I think we're sort of for you.
Oh, is it really? I thought it was 80. I've been telling people 80.
Well,
I thought Ron.
But by the time you put the price
For
postage on,
Okay.
it goes up quite a lot. So they're Australian dollars, and then it's 35 postage for Australia. So yeah, it's about 80. So
Okay.
Rhonda basically sells at the price we do.
Okay.
Because there's
But as a
conversion
practitioner.
As a practitioner, if you have to buy 10 or more for the price to come down,
Okay.
and I think that comes at about 45.
Oh, nice. That's a significant difference.
Yeah. And I know as speech pathologist, you're similar to me as a chiropractor, and you're not going to put a big markup on that. You just want that as a tool for your people. So
yeah,
it's a good saving for them if we stock them. We can make sure they get them, because if they get it from the dentist, they can get a provider number, and they will pay a lot more because it's in a dental environment. They're always going to be so. If they can get it from you, it's a better option.
So guys, that's just an option that you guys can keep them as a speech pathologist in your office if you can afford to order them in bulk and keep them there. Just get a variety of sizes based on your typical clientele. But that's exciting.
Yeah, so then you've got it there to give to a
much
patient.
price.
Yeah, and if you have a group of friends, you can order like that. So if you've got a group of people in your community, you order and you can get that.
All right, so we'll be sending messages on the Simon Says Inner Circle. Who wants to order some MyoMunchees? I'm in the need of them. So look for that. But I think that's all I have for you today, because I know you probably want to get started on teaching. But anything for me that you wanted to ask?
I'm just really excited, Jennifer, to hear about the work you're doing, and I'm very excited about your tongue tips. Tiny tongue tips. I love it, because that's where it's at, getting in early and getting that tongue working, the power of the tongue.
Yes, exactly, the power of the tongue. Well, thank you so much for taking time. I'll give you a hug, because that's what I do.
Great.
And we're going to get to class, and bye, everybody. Hope you guys can tune in, and I'll be sharing some more information after class.
Okay.
Take care.